Good afternoon, ladies and gentlemen. We bring you greetings from Richmond Media Health Issues to your doorsteps. As we all know, today being Sunday, although the sun is really doing its work, but in that case, we also want to think about your health and how best you can promote and maintain your health. Remember, the groundwork of all happiness is nothing but good health. Therefore, Richmond Media Health Issues want to bring some topics, special health topics to your doorsteps, whereby you can sit in your house and watch us or listen to us from anywhere you find yourself. Beloved, this afternoon we want to study or discuss a special topic, and we are saying that the topic is UTI, as you are seeing on the flyer, UTI, urinary tract infection in pregnancy, how we can be able to prevent ourselves from that case. Remember, men don't get pregnant, but you impregnate your wife. Therefore, as a man, you need to listen to this lesson so that you can be able to educate your wife on some of the preventive measures we'll be discussing. And also, we want you to also, if today is your first time of watching us, Richmond Media, then you subscribe so that any time we are bringing health issues to your doorsteps, you'll be the first person to have encounter with. So today, as we all know, anytime we want to bring you a professional who will be able to digest every topic for us. And today, with us, you being the third person, the second person to be our guest now is no other person than Sister Felicia. Then we will welcome her to Richmond Media. So, Sister Felicia, you are welcome to Richmond Media Health Issues.
Hello, Mr. Ackon. Good afternoon. Thank you so much for giving us this platform to educate our people. On this note, I'm saying you should share the link. Yes, anyone you know who has a wife who is pregnant, or anyone who knows someone who knows another person who is pregnant, you should share this link so that this is going to be a very interesting discussion. So I want all of you to come on board so that we can spread the good news and prevent UTI in pregnancy. Thank you.
You are welcome. So, viewers and our listeners, as someone who said, hearing from the horse's own mouth, this is what we are going to study, UTI and its preventive measures. Because remember, prevention is the first and the best form of treatment that anyone can get. So, as we are about to discuss, you realize that we have some individuals who are pregnant and are suffering from UTI. We have some individuals who are pregnant and they are yet to suffer UTI unknowingly. So you are all involved and you are all inclusive. So, Sister Felicia, we want to ask, what should our viewers and our listeners across the world, what should be our expectation in this few minutes of our discussion? Thank you.
Okay, thank you. So, all our viewers, our listeners watching from all over the world, this afternoon we are going to be talking about UTI, or a urinary tract infection, and we are going to look at preventive measures during pregnancy. But before we get to the preventive measures, we must know what the urinary system is. We must know the changes that go on during pregnancy. We must know about what urinary tract infection is, causes and risk factors, its signs and symptoms. And finally, we get to why we must be more focused on preventing it during pregnancy. Thank you.
Thank you. So you realize that we are now going to look at the organ itself it's important before we talk about the condition and how to prevent it. That is how we can appreciate why God gave us a system called urinary tract or the urinary system. So, Mr. Felicia, we want you to take our viewers through what at all can we classify as the urinary system? Thank you.
Yes. So before we go deep into this urinary system, I want us to take a scenario. Madam Kelly, who is a first-time pregnant woman, and she started feeling pain, lower abdominal pain, having difficulty in passing urine, went to her neighbor and complained to her neighbor that this is what she has been going through for the past 1 week, and she feels that it is just normal in pregnancy. And she complained of severe back pain as well. So her neighbor, as usual, advised her to go to the hospital for some consultation and expert advice. In the evening, her neighbor went to check up on her and realized she was cuddled up in bed um, with fever, with chills under a blanket, and the pain had worsened. So her neighbor, being a good neighbor, decided to send her to the hospital for consultation and probable treatment. So on arrival to the facility, she was assessed and realized she was already in labor with a gestation of 32 weeks, which approximately we could calculate as 8 months. It wasn't time for baby to come out, but labor was inevitable and delivery of the baby was inevitable. So baby came out in the next 10 minutes and was referred to the neonatal intensive care unit, where baby was catered for 2 weeks. After that, Madam Kelly was also kept on the ward for 2 weeks because um, it was realized that her infections were not the best and she needed a lot of rest and medications. So at the end of the day, she spent 2 weeks at the facility before being discharged at home to the house. So I want us to, our listeners and our viewers, let's think about this and see what's really happened to Madam Kelly. Yes, and what would have been done to prevent all this. This brings us to our topic for the day, urinary tract infection. So we look at the urinary system. When we look at the urinary system, it is one of many systems in the body. Just as we have the digestive system, we have the reproductive system, the urinary system is also a system on its own. And from our diagram, we can see the location. This is a view of the male urinary system and the female urinary system. So you can see that they have everything in common: two kidneys, we have two ureters, which carry the urine to the bladder. Then we have the bladder itself, then the urethra. With our images, you can see that the female urethra is shorter than the male urethra. So we move on to, so we talk about production of urine. When we talk about production of urine, the urinary system plays a very important role because any toxin that is in the blood will be collected through the urine. And these toxic substances are passed through the kidney through the ureters to the bladder for excretion through the urethra. So these toxic substances, if they are not excreted, will lead to a lot of problems. That is why of late we have a lot of dialysis going on, because these toxic substances are not being excreted the way they are supposed to be excreted by the kidneys, or the kidneys are not functioning. So the dialysis machine has to do the work of the kidney. Yes, so just as we said, it is made up of the two kidneys, two ureters, and one urethra. So we go on to look at the changes. The changes, yes, the urinary system in pregnancy. The reason why we talk about the urinary system in pregnancy is because in pregnancy, there are so many changes that go on, and these changes also affect the urinary system. This is mostly due to the hormones that are secreted during this period, and which includes the relaxin and progesterone. I think some of these things are new to us, and they are something that we have to, embrace. Yes, as time goes on, I'm trying to explain as simple as possible.
Sure.
So yes, so we look at it. We look at the growing uterus. So by the 12th week of pregnancy, you realize that the baby is there. Ideally, the bladder is a pelvic organ. It is supposed to be in the pelvis. And the same way it's a pelvic organ, the uterus is also a pelvic organ, or the womb is also a pelvic organ. So it is sharing the same space with the bladder. So in pregnancy, by the 12th week, you realize that the uterus starts to compete for space with the bladder. And this causes a lot of discomfort for the pregnant woman, especially when she has to urinate every 30 minutes or every 1 hour. You realize that it's very, very uncomfortable. And most of these organs, especially the renal pelvis, which is found in the kidney, they become enlarged, as I said earlier, is due to the hormones secreted during this period. Then the ureters, which connects the kidney to the bladder, they become dilated, they become elongated, and they kink. So when we talk about kinking, it's bent a little. So the flow of urine is not the way it's supposed to be. You realize that the urine, there are little amounts left in the ureters, and this can cause the microorganisms to multiply in such areas, leading to the urinary tract infection. Then we look at immunity. In pregnancy, generally, the woman's immunity is reduced, and this leads to poor immunologic defense. So this woman can't protect herself from other infections. Yes, and we look at the increase in bladder and urethral pressure. By all means, as this baby is in the pelvic area where the bladder is, it will lead to this pressure. So this woman will have incontinence or will tend to urinate while laughing or coughing. And when this is not taken care of, you realize that it leads to this urinary tract infection. Then we look at the last one, which is the elongation and dilatation of the urethra. So the bladder during without pregnancy, you realize that the bladder is a pelvic organ, but during pregnancy, it tends to rise a little above the pelvis. So it pulls the urethra along with it, making it difficult. Sometimes you realize that the urine is there, but the pregnant woman will not be able to completely empty the bladder. So there's a little amount of urine there, which gives space for growth of microorganisms, leading to this urinary tract infection in pregnancy.
Thank you very much. So you realize how she has taken her time to explain to us. Um, a viewer is saying that she never knew that during pregnancy there are these changes that occur within the urinary tract, because they think that the same way you are, that's the same way it carries through. But
Uh-huh.
this also help us to understand how the creator is. He
Yes.
knew that a time will come that something will come into the system as a form of pregnancy. So he has also paved way. So thank you for your time and how you have been able to explain to us, for us to know that even as we are seeing the male and the female, the ureters are not even equal.
Yes.
So we thank you and we appreciate that knowledge. So therefore, it means if you are not taking care of whatever comes in to bring it out as urine, that's
Mhm.
what will bring us to why and how can you explain where can we classify as urinary tract infection, and how will you explain to us? Thank you.
Oh, okay. So as we can see from the images, when we see red, mostly when we see red, we know red is danger. Yes, and these are infections of the urinary tract, as we put. Simply put, yes, ideally, we have normal flora, something we call good bacteria or good microorganisms on the surface of the body. And these organisms are supposed to protect the body against a lot of infection. So the urethra has its own microorganisms. The inner area has its own microorganisms. We have the vagina having its own microorganisms, which we call the Dodelins bacilli, and it prevents the vagina and the rest of the reproductive system from infection. So ideally, there's supposed to be a prevention of infections, but when things happen and these microorganisms are being displaced from where they originally are, they get to other places, they may cause infection. So simply put, urinary tract infection is infection of the genital tracts. Yes, so and this it may include the kidneys. You may have the ureters, which carry the urine from the kidney to the bladder. You may have the bladder itself and the urethra. Sometimes you may have two or more of these organs being infected. And the most common one is with the bladder and urethra. As we saw in our first image, we saw that with the female, the urethra is a bit shorter compared to the male. And that even makes her more susceptible to infections. The most serious form of urinary tract infections involve the kidneys. That means that these infections have traveled from the urethra through the bladder and through the urethra to the kidneys. And sometimes these infections may just be mistaken for this urinary tract infection may be mistaken for other infections like malaria or typhoid. So sometimes people may show these signs and symptoms, and you be like, go and get anti-malarials. I am saying no. Actually, I think you should come to the hospital and seek for expert advice. Yes, thank you. So we look at the proximity of the urethra to the vaginal and anal orifices. In the female, the urethra is above, then we have the vagina opening, then we have the anal opening. I think most women confuse the vagina to be the urethral opening. So sometimes they think the urine also comes from the vagina, which is wrong. Yes. So actually, we have the urethra, which is just above the vaginal orifice. Then the anal orifice is below. And when you see their proximity, they are very close compared to the male. Yes, compared to men, you realize that for the women, all these organs are aligned and they are so close to each other. And this even makes us more susceptible to the urinary tract infection, aside from being pregnant. So we move on to talk about the prevalence. Yes. So in women, it is higher than in men, which translates to about 81%. And it normally occurs between the reproductive age, which is like 16 to 35 years. So around this period, you realize that most women develop these UTIs because they are getting pregnant and they are giving birth. And it is actually estimated that 1 out of every 3 women will at least experience an episode of urinary tract infection in their lifetime. And 27% of women with the first episode will actually come back again with a urinary tract infection. And that is worrying because if I experience something and it's uncomfortable, why should I come back with the same thing again? And then we want to really prevent this. So we need to know the statistics that are coming up. And we are saying that of all antibiotics prescription, anytime the doctor prescribes antibiotics, 15% is due to urinary tract infection. That is quite huge because we want to stop this antibiotic resistance. But you realize that 15% of all our prescriptions are coming from this urinary tract infection, which is accounting to $1.6 billion, which is spent every year. Yes, this is so sad. This is a lot of money being spent just on the treatment of urinary tract infection. So we look at, yes, urinary tract infection pregnancy. So we talked about the overall statistics, and we are looking at in pregnancy. So anytime a pregnant woman reports to the hospital, mostly is due to anemia in pregnancy. But it has been realized that urinary tract infection is the second most common ailment in pregnancy, and it is affecting up to 10% of women, which leads to 5% of any hospital admission. This urinary tract infection is there. There are women coming with urinary tract infection. And as we talked about earlier, the changes in pregnancy, it predisposes these women to this urinary tract infection. And most of them, because they are without signs and symptoms, or they are without symptoms, the women take it for granted, and they quickly spread to the other ascending organs like the ureters and the kidneys and become severe, which lead to maternal and fetal complications, just as the scenario I gave earlier, where Madam Kelly went to the hospital and all that. You realize that this is even supporting it. Preterm labor. Yes, she actually went into preterm labor. It wasn't her time to deliver, and due to this urinary tract infection, she has to go into labor and deliver a low birth weight baby, which was kept on admission for 2 whole weeks. So if she hadn't had this urinary tract infection in pregnancy, I think she would have carried this baby to term and wouldn't have stayed in the hospital for that prolonged period. So we go ahead to look at the types of UTI in pregnancy or urinary tract infection. So we look at I'm trying to break it down as much as possible, but some of the medical terms cannot be taken out. So I'll try to explain them as I move on. So we look at the asymptomatic bacteria. Yes, so when we say something is asymptomatic, that means it's without symptoms. So it doesn't come with any symptoms at all. And with statistics, they are saying 2 to 13% of all pregnant women normally come with this asymptomatic bacteria. That is, you do a urine testing or a urine culture and you realize that there's actually bacteria, presence of bacteria in the urine, but the woman doesn't show any sign or symptom, which will tell you that this is what she is actually reporting with. Then this can further lead to acute cystitis. When we say acute cystitis, it's just infection of the bladder. The bladder becomes infected, and it is accounting for 1 to 4% of pregnant women. So when we look at the asymptomatic bacteria, from there it progresses to the acute cystitis. And if not watched carefully, the next is the acute pyelonephritis. Pyelonephritis is actually infection of the kidneys, simply put. Yes, let me just put it that way. We have a lot of explanations to do, but that is simply put, yes. So it accounts for 1 to 4% of pregnant women. And you can see how serious it is because it doesn't come with any symptoms. So a lot of pregnant women take it for granted. Even we, those that are not pregnant, we take it for granted. Yes, even though this is for pregnancy, we, those that are not even pregnant, can learn a lot from it that will help us before pregnancy. Yes.
Thank you very much. Viewers and our listeners, you realize that we have some male and some, even as she mentioned, who even don't know that when we are talking about the proximity, they thought women urinate through one channel, give birth through one channel, like the male. But we have been made aware that they have three holes. That's what she's explaining to us. So you need to, I know by the end of the lesson, she will be able to explain to us how the three holes we can be able to care for so that infection cannot spread to the other side. And as she was going on, you realize that although the topic is urinary tract infection in pregnancy. So some of our viewers and our listeners were thinking that it's only pregnant women who had UTI, but not knowing even the males can also get urinary tract infection. And those who are also not pregnant too can also have urinary tract infection. But because our focus was on pregnancy, she has been able to explain to us. So it means, as we said earlier, if you are a male, you can never say that you want to just don't watch because it's for pregnant women. And if you are a female and you are also not pregnant, you can't also say that because I'm not pregnant, it's for pregnant people. No, but we have known that it's a school for all. Thank you for those messages. As the saying goes, you mentioned society. Someone was saying, hey, then it means sister because we all the name sister, not knowing, not sister issue, it's not brother issue, but the bladder. God bless you. There's a saying that there's a cause and effect, and nothing occurs without a cause. Even in the Bible, it says that the curse causeless will not have any effect. So, what at all, as our viewers and our listeners are watching and listening, what at all can predispose someone to get this urinary tract infection? Or what are some of the causes of urinary tract infection that we will know and refrain from? Thank you.
Yes, so we look at a lot of causes. Before we can prevent something, we need to know the cause. We need to know what is really causing what we want to prevent. Without knowing the cause, we can't really prevent. So we look at diabetes mellitus. Yes, diabetes predisposes a lot of people to this urinary tract infection because even in pregnancy, there's a lot of production of glucose. That is why when you come to the antenatal clinic, you realize that one of their routine procedures is to check your urine for protein and glucose. So it pre-informs them if you are diabetic. And by doing so, they'll be able to know what is causing whatever is happening to you. So those with the diabetes, one of the signs is urinating a lot. And when they urinate a lot, you realize that um, because the place is always wet, it gives a conducive environment for these microorganisms to multiply and cause infection. Then we look at an indwelling catheter, yes, or what most people term as rubber in our local settings, yes, having an indwelling catheter. Ideally, we talked about normal flora. So when the microorganism is moved from its functioning area to another area where it is not functioning well or is not needed, it will surely cause an infection. So with the indwelling catheter, you can adhere to every infection prevention technique. But for the fact that you are passing this catheter, you are moving, you are displacing microorganisms from one place to the other. And by all means, they will cause infection. Then I don't need to say so much about pregnancy because you have realized that pregnancy alone predisposes you to this urinary tract infection. So we look at labor and delivery. Yes, we are talking about pregnant women, and mostly when there's trauma to the birth canal in the process of delivery can predispose this woman to urinary tract infection. Then we look at these organisms that cause this urinary tract infection. We look at the E. coli, what most people call E. coli, Escherichia coli, or E. coli. Mostly it is found around the anal area and the small intestine. So when they are moved from where they are and they get through the urethra, you realize that they start to cause infection. We look at the proteus, the Klebsiella pneumonia. Those are some of the microorganisms. You don't need to delve so much into it. Yes. Then we look at the conditions that lower the immunity. So far as your immune system is down, there's a possibility that you may have a urinary tract infection. Then look at poor personal hygiene. People who don't like bathing twice a day, yes. Those who try to run away, especially our men, you try to run away from bathing twice a day, yes, you can easily get the urinary tract infection. Then we look at poor vulvar or perineal hygiene. This is especially for the women, as we talked about earlier. We saw the proximity of all these openings. And if you are having poor vulvar or perineal hygiene, where you are just cleaning anyhow and washing your vulva area anyhow, you are douching, you are pouring water there, just pushing things there to make the place tight, to make the place firm, realize that you are predisposing yourself to urinary tract infection. Then having sex on its own, yes, this is an interesting one. Having sex on its own predisposes anyone to a urinary tract infection, because ideally the man has his own normal flora, the woman also has her own normal flora. Then during the process of sex, there's a mix up. So you realize that there's exchange, even though you are exchanging other things, you are also exchanging normal flora. And this normal flora can easily cause this urinary tract infection. Then if you have a previous history of urinary tract infection, you realize that from our statistics, we said that people that come with urinary tract infection may come back again with this urinary tract infection. Yes, so those are some of the risk factors for this urinary tract infection. Thank you.
Welcome, and God bless you, because we don't know what can cause these things and what can predispose or make us at risk. And if you are not careful, you might end up, you want to prevent, not knowing you might be at risk of the things that we mentioned. But note that whatever we are saying, you realize that if you fall victim within this, you need to be careful, because if you are getting any infectious condition pertaining to the urinary system, then you can get urinary tract infection. That's why you need to seek counseling whenever there are some changes. God bless you for this in-depth knowledge you have given to us. So, in any case, when there is a cause and its effect, the effect will give us some changes within our system. What should I expect, or what should happen to an individual for that individual to notice that no, these signs or these things I'm going through might suggest urinary tract infection? Thank you.
Okay, thank you too. So we delve into the signs and symptoms. So before it becomes complicated or before complications arise, we should see something that will alert us that this is what is happening to my urinary tract system, my urinary system, for me to report early for prompt treatment. So normally people present with this strong urge to urinate that doesn't go away. Sometimes even after urinating, you realize that you still feel like passing urine, but it is just an edge, just because you have a urinary tract infection. Yes, so you watch out for this sign. Then a burning sensation after urinating, it feels like pepper. Let me put it that way, pepper. Yes, it's down there, and this is a very uncomfortable feeling. So then you know that it could be a sign of a urinary tract infection. Then you are always urinating and passing small amounts of urine. In pregnancy, with the first 12 weeks, it is normal. You find pregnant women every 1 hour, because of the changes that occur. You realize that every 1 hour they are passing urine. Yes, it is true, but you should check it even as a pregnant woman. Because of that, you can easily be predisposed to the urinary tract infection. So when you are urinating often more than necessary, then you should know that you may be heading towards a urinary tract infection. Then when you urinate and it looks cloudy, there's a strong smell. Yes, you come out of the washroom and anyone that follows up after you notices that this person, it's a strong smell, then you know that you are developing or you have already developed a urinary tract infection. Any urine that appears, let me say, colored, yes, so you have red urine, bright pink urine, you have cola-colored, not Coca-Cola, but cola-colored urine. Yes, your urine is dark. It's looking like cola. Any sign of blood in the urine is telling you that you are having a urinary tract infection. And especially with women, you have pelvic pain. Yes, and these are just the general signs and symptoms of urinary tract infection. You realize that as we move on, you see that there are some of the signs and symptoms that are peculiar to the organ that is actually involved. When you talk about some of the organs like the kidney, the ureter, the bladder, there are some of the signs and symptoms that are peculiar to those ones. Yes, so I think subsequently, yes. So we look at the kidneys. In the kidneys, you have high fever, you have your temperature going up, just as in the case of Madam Kelly, where the neighbor noticed her temperature was up and she had to send her to the hospital. So you realize that she has gotten to this stage that the kidney has been infected. Then you look at the shaking and chills. Then there's nausea and vomiting. And this particular sign, which is the back pain or side pain, that is actually the location of the kidneys on our body. It is actually, we call it costovertebral, but it is actually at the back. So when you tap your back on the sides, your lower back on the sides, and there's pain, then you know that you have gotten to this point that your kidneys have been damaged or there's a urinary tract infection, which some people call the pyelonephritis. Yes, then we look at the bladder. So if your bladder has been infected, there's lower abdominal pain, there's pelvic pressure. You realize that you urinate a lot and it is painful. Sometimes some people find the blood in the urine. Then when it affects only the urethra, there's a burning sensation when urinating, and normally there's a discharge from the orifice or the opening where you urinate from. There's a discharge from that area. So some of these symptoms, they are peculiar to whichever organ has been affected. Thank you.
Welcome. This explains why initially you mentioned that some of these symptoms might mimic malaria, and
Yes.
individuals, when they are having fever, chills, nausea means that you don't feel the urge to eat. Then,
Mhm.
the person quickly goes to the any shop around, pharmacy shop around. I want to buy malaria drug. So, as you said, yes, whenever you are feeling some of these symptoms, we need to make sure we undergo proper treatment or proper investigations to confirm that you have malaria, or
Mhm.
probably it might be urinary tract infection. And you mentioned one thing about the bladder signs. You realize most women will complain, or most men, because you have talked about the that men can also get urinary tract infection. Whenever an individual is suffering from lower abdominal pain, commonly they will go to the pharmacy. I want to buy gin. That's what they term it in Ghana. Oh, we are buying gin so that it can just reduce the pain. But here we have known that not all abdominal pains means that it's your stomach that is having the problem, but
Mhm.
it might be as a result of urinary tract infection. And if you don't look at it well, and you go and buy the pain medication, it will go down. You think you are fine. Meanwhile, as we have said, I know we'll go deeper into it. The infection might be multiplying, as she talked about, and you'll be taking gene, by the time you realize it will move from gene to H to Z, then we get the complication. Okay,
Yes.
thank you. Thank you.
Yes.
So, on this note, we have known some of these signs and symptoms, and you realize that some resembles other conditions.
Yes.
That's why we are not saying that whatsoever we have mentioned here means that when you are going through, then it means you have UTI. No, because you might be having the urge to urinate,
Yes.
frequently urinating, but it might be a kidney problem, or it
Mhm.
might be a high blood sugar issue.
Mm.
But if
Yes.
you want to confirm, don't sit in the house and diagnose yourself and self medicate. but rather seek the proper care. God bless you for this information that you have given to us. So on this note, someone is in the house who has been diagnosed of urinary tract infection. Someone is also now seeing these things. He's saying that yes, I'm also sensing some of these things. So how can we prevent ourselves so that our viewers and our listeners who are now who want to now prevent themselves well can now adhere to certain advices that we can give? So how can we prevent ourselves from this condition? Thank you.
Oh, okay. So, actually, we are talking about urinary tract infection, but I just want to chip in this that anytime you are feeling uncomfortable, you are not feeling well, don't sit in the house and self-diagnose yourself.
Exactly.
Come to the hospital where there are experts. That is why people go to school to train for so many years so they can take care of you. So the best is to come to the hospital. It is better to come to the hospital and nothing is seen than to be in the house and complications arise. Yes, so we are talking about prevention of urinary tract infection in pregnancy. Even though it is in pregnancy, but as ladies, as guys, some may apply to us. Yes, we want to keep the urinary system clean and free from infection. So we talk about nutrition. A lot of people would not look that way, but nutrition plays a very important role in the prevention of urinary tract infection. We talk about taking a lot of fluids, at least 8 to 10 glasses a day. When it happens that way, you realize that you are producing urine quickly. And it doesn't mean after taking that 8 to 10 glasses a day, when you have the urge to urinate, you sit there and not do anything because the body is trying to get rid of toxic substances. So when you take in the water and the body decides to get rid of it, you must obey the body. Yes. So you take in a lot of fluids. Always make sure you are hydrated. You eat adequate diet contain the right amount of nutrients. Yes, some studies have noted that cranberry juice, the cranberry helps to prevent this kind of urinary tract infections. And for those who take in alcohol, we are saying that you should avoid alcohol, anything citrus juices, caffeinated drinks. Yes, small time you want to take something to keep you awake, you want to do your things at night, you are always taking caffeinated drinks, we are telling you that it irritates the bladder, so stay away from it. And as I said earlier, we take in a lot of fluids. Don't just sit there and saying, I'm taking 8 to 10 glasses of fluids. So I'm keeping the urinary system well. You should, when there's an urge, you should go. You should use the washroom. You should pass the urine. Don't wait until you are pressed. And there's a funny thing people used to do, and you realize that at that point where you are trying to even look for your key to open the door, you won't even find your key. Yes, because you have kept the urine for too long. And we are saying, say no to that. Anytime the urge comes, you urinate. And we go to sex. Sex is one thing that most people don't really talk about, but it's one of the causes of urinary tract infection, especially in pregnancy and the non-pregnant women. Yes. So before sex, you have to pass urine before and after. Just as I said, during sex, there's exchange of fluids. Some people use their fingers which have not even been washed. So during this period, just right after sex, make sure you urinate to clear the urethra from any other microorganisms that may be lingering there. And some people even say that the best is to wash the vulva area, especially for our ladies, to wash the vulva area after sex, because during the process of intercourse, we have their vaginal fluids. We know their vaginal fluids. We know their seminal fluids that come out, and they are all there around the urethra. Yes, so it is best to wash the area right after sex. So when you're engaging in sex and you feel that the place is dry, you want to use lubricants, I think you should go in for a water-based lubricant instead of the oil-based lubricants, because this can even cause conditions to worsen. Yes. So we look at a second aspect, which is hygiene. Hygiene is, let me say, with almost everything that goes on with the urinary tract system, hygiene is number one. We must always keep the perineal area, or the area where we wear our panties, clean. For our ladies, for our guys, we have to keep those areas clean. You maintain your personal hygiene, as I said earlier, when we're looking at the causes. So with the causes now, we are knowing how to prevent it. We bath at least twice a day. We use cotton underpants, and it's cotton because they're looking at our weather in this part of the country. Realize that there's so much heat and we sweat a lot. Yes, aside that, in other parts of the countries, you realize that if you are engaged in um, jobs that require that you are sweating a lot, you should always make sure that you are having cotton underpants, and you should avoid too tight panties. Anytime your panties get wet, yes, you should try and change. And there are some women who also use panty liners, just as some people are allergic to some panty liners, but it will be to your best interest. At least with the panty liners, you can easily change them when they get wet. Then we look at one important part when we are cleaning the vulva. After either urinating or defecating, you realize that our ladies, they are always carrying tissues to the washroom. Yes, they want to clean the area after urinating. So you clean from front to back. And this is because of the arrangement of these orifices. You look at the urethra is in front, followed by the vagina, then the anal area. So anything you push from the anal area to the urethra becomes provides an area for the growth of microorganisms. So it is best to push all those things back when you are cleaning. Then we look at douching with our women. You want to keep the place tight. You want to keep your vagina tight for your partner. Most women try to douche, and when it happens like that, this normal flora sometimes from the vagina comes out and it gets into the urinary tract through the urethra. So when it happens that way, you realize that you have exposed yourself to this urinary tract infection. Then the use of sprays and powders, you want the place to smell good, you want the place to smell nice. Yes, all these things should be discouraged. It will just displace most of this normal flora, and at the end of the day, it will lead to this urinary tract infection. So we go on with the prevention. We talk about hand washing. Yes, hand washing is the top of it all. Something a lot of us do not pay attention to. Hand washing before and after touching the vulva. We perform our routine hand washing because anything you touch, you can easily introduce to the vulva area, and this may cause infections. Aside the urinary tract infections, they may cause other infections depending on whatever you have touched or whichever microorganisms you have picked using your hand. Yes, it may lead to other infections. Then, as I said earlier, we looked at the signs and symptoms of the urinary tract infection. So it is up to us to identify these signs and symptoms. And I said it and I'm saying it again. The professionals are in the hospital. They are there because of you. It is better for you to report than not to report at all. They are there to diagnose and treat you and give you the appropriate treatment. So don't stay at home. and get over-the-counter medications. Don't stay at home and try to cook other herbs or other things to cure yourself. It is best you report to the hospital for prompt treatment. Then we talk about regular antenatal attendance. So for our pregnant women, this is an advocacy time. I'm telling you, when you are pregnant, don't just stay at home. That I want my pregnancy to get to the 20th week, or I want my pregnancy to get to the 30th week before I start my antenatal clinic. The moment you realize you are pregnant, please move to the nearest antenatal clinic, because during every antenatal visit, our midwives take their time to screen you. You pass urine and they test for protein and for glucose. So if there should be any urinary tract infection, it can easily be picked from the onset and treatment to be given appropriately than to stay at home. When you now develop this urinary tract infection, that is when you are now coming to the hospital. You actually want to prevent it. And antenatal attendance is one of the ways to prevent it in our pregnant women. Then we look at adherence to treatment regimen. Most people, yes, I know there are a lot of people as Ghanaians, the moment we don't have any signs and symptoms, they are like, oh, this medication has finished working. You've been given medications to take for 7 days. By the third day, you are feeling fine, so you decide not to continue. At the end of the day, we are calling something antibiotic resistance. When it happens this way, you realize that the same antibiotic will be given to you for the same urinary tract infection, and it wouldn't work because you have stopped along the way several times. So it's an advocacy point. Anytime you are giving medications for urinary tract infection, let us make sure we adhere to it. We take the full course. If it is 7 days, we make sure we finish the 7 days and we take them right on time. Yes. So in all, we are saying that for urinary tract infection, we can prevent it, yes, because it's very uncomfortable. It is not the best that our pregnant women or our women keep coming back with urinary tract infection. That means that whatever we are doing, we are not doing it well. So I think with just this little education or this little talk, it will go a long way to save someone somewhere or to help someone to even prevent this urinary tract infection. And I've actually added some references. If you really want to read on urinary tract infection, you can get some of them from these areas. Yes. And most of this, we are actually, there are researches that have gone on as time went on, and they talk about the new development. So for those who are really interested, you can further go ahead to read on whatever we have discussed. Thank you.
Thank you, thank you, thank you, thank you. God bless you. So, our viewers and our listeners, you've known that upon everything, there is the final part is that make sure you pass through, you are screened, and a condition is being detected. And if it's being detected earlier, if it's being detected as well, it's able to also be reversed and it can be prevented. So it's not a deadly condition that when you are being diagnosed, it means you are dead. No, it's something that can be prevented and can be
Yes.
treated as well. But don't sit in the house, self diagnose, and self medicate. That's not what we want to encourage. Thank you. God bless you for your time. There are some questions from our viewers for you.
Yes.
Someone is saying I think she was following every step, and she says that God bless you for your presentation. I have
Thank
been
you.
diagnosed of UTI and have recovered from the symptoms that I was experiencing. Can I still use the panties I was using before getting this condition? Thank you.
Oh, okay. So actually, what we do is that anytime you have recovered from this urinary tract infection, it is advisable that you do away with all those panties that you used before, because sometimes it is assumed that you may have picked some of these microorganisms from this underpants you have used. So anytime you have finished your treatment, or even with the start, by the time you are done with your treatment, you should be able to discard all these panties and get new set of panties. So anytime you go for how do I say it? Anytime you go for screening, the next screening, and you are still diagnosed with a urinary tract infection, then we can rule out that these microorganisms are not really from the underpanties that you are using, because you have actually discarded them. Yes. Thank you.
So in Ghana, don't think about the economy to save the prey. You think about your health to discard your UTI panties to save you. Thank you. Mr. Dorcas is saying that you are doing great work. Adherence is always the best. Thank you, Mr. Dorcas, wherever you are also watching us. And someone is asking, as you're mentioning the male, and it's like it's talking about the men and the women. Someone is saying that upon all these, so does it mean children can also get UTI? Thank you.
Yes, thank you. Yes, it is possible that children can also get this urinary tract infection. So far as you have a urethra, you have a bladder, you have kidneys, you have ureters, the possibility is there. Yes. So it is just for, I didn't really go into the children parts because we're really talking about pregnant women. Yes. But
Exactly.
those of us who allow our children, they are always roaming, they are playing in the soil, with panties, sometimes without panties, you realize that this your child can easily have a urinary tract infection. So we are not excluding them. So far as you have the urinary system, you are predisposed to this urinary tract infection. Thank you.
Welcome. I think this sister was really following us. And she's saying that you mentioned about cleaning the vulva and the perineum, vulva and perineum. What constitutes or what and where can we see the vulva? I think that's the question. We want you to help her know where, because I think she don't want to get this UTI, so she wants to
Yes.
clean. So you mentioned vulva, and she wants you to clarify vulva for her. Thank you.
Yes. So when we talk about the vulva, it is part of the reproductive system, and it is the outside of what we see. So just below your abdomen. Yes, from the months. I don't really want to go technical, but from
So
where
from
your hair,
where the hair grew.
yes, where the hair grows down there, around your vaginal area to the anal, before the anal area, it constitutes the vulva. Yes. I don't really want to go into details. I would have
Yeah,
described some parts. Yes, but it is something we women have, which the men do not have, and that is a plus one. Yes,
okay.
we have it. Yes, and the men do not have it. So every woman has a vulva, and it is our duty to care for our vulva, especially with our shaving, with our cleaning. It should be on point almost every time. Thank you.
Thank you. So sister, I hope you have it now. And someone is also asking that you mentioned about doching. And what is that? Because you stress on it, and at the same time during the preventive measures too, you stress on that. And she's asking what is doching that she will not do. Probably she might think it's different thing, and your explanation will also be different thing. Thank you.
Yes, yes. So most women, we try to pour water in the vagina. To we some women view the vagina as an unclean organ, so they try to bring out whatever is in it by pouring water, yes, and other things. Some people add herbs, some people add scented things to it because sometimes it confuses them that what is this organ always bringing out discharges. Ideally, my body is not supposed to bring out discharges, so why is it coming out with discharges? So the best way is that I have to pour water there to bring out or try to cook. There are some people who also try to cook the place. Yes, they sit on steam and other things, but douching ideally is just, trying to pour water, pour other things there just to bring out whatever is in the vagina, and this can lead to this urinary tract infections.
Thank
Thank
you.
you.
I hope our viewers are following the thing and they keep asking. So someone is asking that now she has known the signs and symptoms. Is there any labs that she can also walk in to do because she don't want to get complicated form of this condition? Thank you. If you can suggest
Yeah.
some labs that we can do to prevent
Yeah.
ourselves from this condition.
Oh, okay. So thank you for my pregnant women. We know we normally do the urine testing, the routine urine testing, where every pregnant woman, whether you're on admission or your first time walking in, or your subsequent ANCs, we do this urine testing. So you take midstream urine. Normally they tell you midstream because they feel that if to be able to identify an organism, then that means it should be throughout the urine. So the first urine you pass is not collected. The one behind it, yes, or midway, then you collect that urine for testing. And it is normally done early in the morning. So you realize that in some hospitals you come and they tell you that we cannot take this sample at this time. Maybe we can just take it early in the morning. And depending on this condition, so we have the routine urine testing. In case you have been upgraded or there are serious infections like the acute cystitis or pyelonephritis, that is when you'll be asked to do a urinalysis, a urine testing, and all these things are being recommended by the doctors. Yes, you don't get up and just walk in and say, I want to do a urine testing. No. Actually, with the signs and symptoms you present, the doctor will request for these labs to be done. And in very severe forms of this, we look at the BUE and creatinine. Yes, in most severe forms, we want to see how your kidneys are functioning. So we look for the blood urea and electrolytes, how well your kidneys are functioning. Yes. So these are some of the labs the doctor will prescribe if you should walk into the hospital reporting some of these signs and symptoms. Thank you.
Welcome. I think our viewers have now released you with their questions. But what they keep saying is that God bless you for the wonderful presentation and the thanks.
Amen.
God bless you. God bless you. That's what follows. And we
Amen.
are also saying that God bless you because it's
Amen.
not easy. This is a serious condition, but we don't see people talking about it out there.
Yes.
Yes, so we have known that there is something we call urinary tract infection. And if you've heard nothing, its signs also shows like malaria and
Yes.
also shows like abdominal pain. But we are
Yes.
saying that don't sit in the house to self-diagnose and self-treat yourself. But make sure you visit the hospital as she has mentioned to us so that proper screenings can be done, then proper care can be done. God bless you for your time. So as we are about to leave you, what is your take-home message for our viewers and our listeners? Thank you.
Oh, okay. So on this note, I would like to thank Richmond Media. You are doing so well by bringing health to the doorstep of each individual through this interesting platform. Yes, and my take home message is that urinary tract infection is something that we may not actually see, or we may not actually see the severity of. But through this presentation, I hope that we can tell someone to tell someone with all that we have said. Anytime you experience these signs and symptoms, the best place is the hospital and to seek medical advice, not to self-medicate. And yes, we can actually prevent it. So looking at these preventive measures, I think we can all, in one way or the other, prevent this urinary tract infection.
Okay. Thank you. God bless you. Sister Felicia is the JRNMA treasurer, Kwando District. JRMA is not something different, but it's a Ghana Registered Nurses and Midwives Association that they have. And within the districts, when you come to Ghana in the Volta region, there is a part called Kwando, and she's our treasurer. So, calculating money, dealing with how to send money to someone, how to take money, is a busy work. She having this time and hour spending with us means that it's a sacrificial thing that she has done. So together, Richmond Media, with our viewers and our listeners, we are saying that God bless you. And we know that today will not be your last time, but you continue to come whenever we call upon you. So God bless you, Sister Felicia, for being our guest today for this wonderful presentation. We've really enjoyed the presentation. God bless you, our viewer and our listener across the world, for listening and also watching us. But remember, Richmond Media is a platform that Sundays, like between currently UK and Ghana time is the same. So 2 o'clock p.m. Sundays, we will bring health issues to your doorsteps. Then also Thursday, 6:30, we will bring you something that pertains to the house. We will call it a FISM, and that one too, we discuss issues concerning family. Then on Friday, 7 o'clock p.m., we call something Adum Toya Enije, where we will sing, because UTI can be prevented when you are dancing. As you sweat, you go and bath, and it boosts your immune system to be able to fight any other infection. So come and dance and boost your immune system to be able to get inner immunity to fight all conditions. So see you next week, same time, Richmond Media Health Issues. God bless you all. Bye bye.